Good afternoon, Chair and members. Omar Altamimi with CPEHN, the California Pan-Ethnic Health Network. Appreciate the questions earlier, expressing our shock at the proposed cut and respectfully request a rejection of the governor's proposal to cut the community advocacy program in a year where revenue was $16.5 billion over projections. Cutting $6.7 million from a legally enshrined program is draconian and unjust, especially a program that engages BIPOC, Native, LGBTQ, and other vulnerable communities on these BH issues related to Prop 1 as required by law. Thank you.
Good afternoon. My name is Andrea Mackey. I'm the Associate Organizing Director with the California Pan-Ethnic Health Network, and we reject the cuts to the Commission of Behavioral Health.
Good afternoon. My name is Lindsay Rodriguez, and I'm the Health Policy Advocate at the Mixteco Indigenous Community Organizing Project on the Central Coast, where I live and work in Lompoc, California. I'm here to reject the elimination of the Commission for Behavioral Health Community Advocacy Program. We urge this committee to stand together with the state's most vulnerable population. Thank you.
Good afternoon. My name is Alondra Mendoza. I'm community advocate with the Mixteco Indigena Community Organizing Project in Ventura County on the Central Coast. I am here to reject the elimination of the Commission of Behavioral Health Community Advocacy Program. During this time of family separation from ICE, the emotional scars are left behind to our community members, and we urge this community to stand with the most vulnerable population. Thank you.
Good afternoon. My name is Daisy Salazar. I am a program manager with Mixteco Indigena Community Organizing Project in Santa Barbara County on the Central Coast. I oversee a prevention early intervention mental health program known as ALAS. Cutting the Commission for Behavioral Health Community Advocacy Program would pose a critical threat to our Indigenous communities' well-being. Please fight to keep the BHCA program. Thank you.
Good afternoon, chair members. My name is Juan Carlos Diaz. I'm a community advocate with the Mixteco Indigena Community Organizing Project, also known as MICUP, in Ventura County on the Central Coast. I'm here to reject the elimination of the Commission for Behavioral Health Community Advocacy Program. We urge this community to stand with the most vulnerable communities. Thank you.
Thank you. Good afternoon, Chair and members. Vanessa Teran, Director of Policy with MICOP. As an advocacy organization dedicated to serving the Indigenous Mesoamerican population, we express significant concerns regarding the proposed cuts to behavioral services. These reductions will directly impact two critical initiatives in our prevention and early intervention programs for mental health and domestic violence in the Central Coast. On behalf of MICOP, we respectfully urge the subcommittee to reject the proposed $6.7 million cut to the Commission for Behavioral Health Community Advocacy Program in the May revised. Thank you.
Good afternoon, Chair and members and staff. My name is Tweedo on behalf of the Southeast Asia Resource Action Center. I urge you to please oppose the May revised proposal to cut $10 million from the Innovation Partnership Fund, eliminating half of this program, grant program, which stripped critical funding to be granted in July of this year to services for California's most vulnerable populations, Southeast Asian American organizations serving families impacted, refugees impacted from the Cambodian genocide, Vietnam War, and secret war in Laos, have applied to IPF to address the stigma, language barriers, historical trauma, and the lack of cultural relevance care. So thank you so much for your time.
Good afternoon. My name is Sangeeta Gautam. I am a mental health specialist at Center for Empowering Refugees and Immigrants. Our organization is funded by Commission for Behavioral Health Community Advocacy Program. We reject the governor's proposal to eliminate this program because eliminating this program would remove the primary way that our vulnerable communities can meaningfully participate in planning, oversight, and continuous improvement of Behavioral Health Services Act that ensures communities receive essential mental health funding and services. No decision about communities without communities. Thank you.
Hello, my name is Erin Scott, and I'm here on behalf of Refugee Enrichment and Development Association, REDA, here in Sacramento. I'm here to oppose the proposal to cut CBH's community advocacy program. This program is critical in engaging refugee and immigrant communities in BHSA as required by law. A cut to this funding is a cut to our most vulnerable communities. Thank you.
Good afternoon. My name is Ravi Sang, and I'm with the Cambodian family in Orange County. We've been serving the immigrant and refugee communities for 46 years, and the community advocacy program has been instrumental in helping smaller organizations like ours build the capacity to advocate for our communities. We've been able to have monolingual and ESL Cambodian community members submit their feedback to local 3-year plans in language. Local engagement would not be possible without the community advocacy program, and we've only been able to move the needle this far because of this investment. We call on the legislature to reject this proposed cut.
Hello, my name is Kikoa Lopez Baguyo, and I'm the grants manager at the California Pan-Ethnic Health Network. And I reject the governor's May revised proposal that would eliminate the Commission for Behavioral Health Community Advocacy Program, which enables CPEHN to advocate with partners statewide to inform county-level BHSA integrated plans as required by law, and would threaten funding midterm while community engagement for final county BHSA integrated plans are at the highest need. Thank you.